Hello, uh, I'm Dr. Harpreet. I'm a gynecologist at a private sector here in Sector 125, Kharad, Mohali. And today we are going to discuss about the preterm birth and its related complications. As we all know, a pregnancy has a total of 40 weeks. So any pregnancy which is has not completed 37 completed weeks and leads to a delivery before 37 is a preterm birth. Surprisingly, India tops the world in the prevalence rate of preterm births, and the prevalence rate being from 11 to 16%. Now, today we are going to discuss in detail about what exactly is preterm birth. In preterm births, what are the uh, circumstances under which preterm birth is we assume it is going to be a preterm birth. So there are certain risk factors, like in a medical history we ask the patient if the patient has a previous history of preterm birth. In the successive pregnancy she has more chances of a preterm labor and a birth. Second, if a patient has a cervical length less than 2.5, then which can be detected on an ultrasound, or we can check on a pelvic examination. If a patient has a shorter cervical length, then also it leads to preterm birth. And if a patient has a previous history of any procedure on cervix, then also there are certain chances of patient having high risk towards preterm birth. Then comes the lifestyle. Patient who has history of smoking or has low weight, and they are of different, like less than 17 years of age or more than 35 years of age, they have also greater chances of landing into preterm birth. And plus there are, if there are multiple pregnancies like twin pregnancy or triplet pregnancy or polyhydramnios, or if the patient has history of bleeding in pregnancy, earlier bleeding in pregnancy, then also there are chances of preterm birth. So now we are going to discuss what should we do if we have a preterm labor. So there are two types of patients: one who have threatened preterm labor and other who have true preterm labor. Threatened preterm labor, there are no changes on in the cervix, so the patient can be admitted, can be put on short-term tocolysis, and can be managed conservatively without resulting into a birth or delivery. But in a preterm labor, if it has been set up with, there will be cervical changes, so leading to the birth of the baby. In that case, we, in a short term tocolysis, we give injection beta-methosone for the lung maturity, and we try to postpone the delivery to certain extent, and whereby after that, so that the lungs can be matured, the patient is delivered. So how do a patient know that there are certain signs that the patient might go into preterm labor? So the signs are, a patient can have uh, constant low backache. Patient can have uterine cramping. Patient may complain with the problem of white discharge or sometimes pinkish discharge, or some watery discharge, and some constant uterine cramping can be there. So these complaints patient can come. So we do a pelvic examination on that patient. We do a PV and know whether there are certain changes in cervix or not. Right. So what a patient has to do when you come across such symptoms, you should directly call your gynecologist or reach your nearest hospital or where you are showing, and get yourself checked to prevent the labor. And so that if the labor has already pursued, then we can give timely injections for the lung maturity, so we can help in the lung maturation of the baby. And now we should know that if a baby is born preterm, what exactly are the certain complications that happen, like short-term complications and the long-term complications. Short-term complications means the patient baby can have low birth weight and can have underdeveloped organs, right? But in the long term, there can be some intellectual problems. Baby can have behavioral issues in a later life, and some of the very preterm babies, they can have vision complications, and even severe can have cerebral palsy. So it's a matter of concern, and whenever a patient do feel some symptoms and have a history, as we have discussed, they should reach to the gynecologist as soon as possible so that we can take care of the baby. Thank you so much.